So, for the last 2 weeks, we've been talking about the topic of abortion, and we've been focused on kinds of life and death decisions that people have to make towards the beginning of life. And in this last week together, what we're going to do is we're going to turn to life and death decisions that people make towards the end of life. And one of these big decisions is how we make medical decisions when people's lives have reached a certain point where their life becomes a burden to them. And there's a choice, or there are a number of different choices that can be made here about if a person wants to hasten their own death and whether or not that kind of decision is morally permissible or not. Now, this is a kind of decision that, unlike the topic of abortion, where we saw that the issue of abortion is one that's gone on for centuries and centuries and centuries. There are kind of unique problems that we are confronted with that people 100,000, 2,000 years ago weren't confronted with. I mean, let's be clear. People have always been confronted with decisions about pointing where their life seems so burdensome that they no longer want to live, or maybe they suffer from some kind of medical decision. But what makes this topic of end-of-life choices particularly unique in our own generation is that medical technology has evolved to a point where we can actually keep people alive indefinitely on machines, or keep people alive indefinitely with the use of certain medications and drugs. And so we are confronted with this kind of choice, certain end-of-life choices, in a way that people even 100 years ago weren't. If you were to get certain medical conditions 100 years ago, you might just die within a few days, but now we can treat you and keep you alive indefinitely. If a person were in a comatose state 100 years ago, well, they'd probably starve to death within a handful of days because they couldn't eat, but now we can insert feeding tubes. If a person's lungs collapse 200 years ago, well, they die instantly. Now we can hook them up to a respirator and keep them alive. And because medical technology has evolved in this way, we are confronted with a series of different kinds of ethical questions that arise, and different kinds of choices that arise. And one of those choices that arises is when exactly we might want to remove life support from a person, or when they might want to have life support removed. This is sometimes referred to as passive euthanasia, though that term is no longer really in vogue. You'll find out why later on, but this is a kind of medical decision that arises. Currently, in every state in our country, removing life support is something that is legal to do, assuming certain protocols have been or criteria have been met. There are protocols in place to make sure this is done in a way to minimize risks. Obviously, we don't want people just removing life support, if a person is going to recover within a week or so. I don't know if you guys have ever seen the movie Talladega Nights, but in the movie, this guy, Ricky Bobby, gets in a car accident, and he's perfectly okay, but his wife, who is characterized as like kind of a gold digger in the movie, she's telling the doctor, she's like, he wouldn't want to be kept alive, just remove his life support now. And he's sitting right beside her, and he's perfectly conscious. He's like, I can hear you. He's saying out loud, as she's saying, remove his life support. And he's like, I'm perfectly okay. And then she keeps reiterating, remove his life support. So we don't want that, but there are protocols in place that would prevent someone removing life support prematurely. But if it's been determined that a person has reached a point where they're no longer going to recover and they can't speak for themselves, it is legally permissible, and I think most people consider it ethically permissible to remove life support. If a person if a person is conscious and they say, and they've been deemed to be competent, they can refuse medical treatment at any point that they desire. As long as a person's been deemed competent, they can refuse life-sustaining treatment. So this is something that there are, and I don't want to minimize this, there are certain kinds of ethical questions that surround this, but the reality is that a lot of the ethical questions that surround, and especially the legal questions that surround the point at which we can remove life support have been answered, at least in the law. There have been a number of cases that have been decided over the last 20, 30 years to address this. Something, however, that is much more controversial and is currently being decided right now in the United States is the issue of assisted suicide. And physician-assisted suicide is a particular form of assisted suicide. I'll probably sometimes, just because I don't speak exactly precisely at all points, but I might just say physician-assisted suicide. But keep in mind, assisted suicide is whenever one person helps another person in their own life. And physician-assisted suicide would be when a medical person helps somebody else in their own life. Let's suppose that I were to help you end your own life. Well, that wouldn't actually be physician-assisted suicide because I'm not a medical doctor. But if you went to your doctor and your doctor prescribed you a lethal dose of medicine and then you went home and took it, that'd be physician-assisted suicide, if we're being technical here. And this is much, much more ethically and legally problematic than removal of life support. Currently, and some of the laws have changed recently, but I think that there are currently 6 states that allow for physician-assisted suicide. All the remaining states, physician-assisted suicide is illegal, and actually assisted suicide of any kind is illegal. Now, the reality about this is, even though it's illegal in those remaining states, it's actually seldom prosecuted. And I say seldom prosecuted. What I have in mind here is, if somebody has been battling cancer for a period of time and you maybe help them in their own life, it's really hard to get a prosecution for assisted suicide in that particular case. Now, if it was someone who was like 16 years old and you gave them a gun and you encouraged them to kill themselves, well then yeah, you probably will go to jail. That's very different than someone who is up there in years and has been battling with condition. That's something that's really hard to get a prosecution for, because juries in general are very sympathetic to someone in that particular situation. They understand someone who's been dealing with extreme pain for a number of years. But a physician-assisted or just assisted suicide in general is much more morally complicated, because here, unlike with removal of life support, we're actually talking about being the cause, or someone being the cause of their own death. When we're looking at removing of life support, the reason I think a lot of people consider this ethically less problematic is because when you remove life support, you're not actually the cause of someone's death. Their condition, whatever it is said to be the cause of their death. So for instance, if someone, let's say, is being hooked to a respirator to be kept alive, then if you remove that from them, then they die, not because you've inserted any kind of foreign chemical into them, or they've inserted any kind of foreign chemical into themselves, but rather it's their condition that kills them. And so the moral difference here between removing life support and any kind of assisted suicide is the level of causality involved. And in removing life support, you're not technically the cause of their death. Their condition is the cause of their death. Whereas with assisted suicide, you're actually helping someone cause their own death. And so it gets much more morally problematic. And this can be illustrated with a simple kind of thought experiment. And so some of you might be thinking, yeah, well, there's a very thin line here between, their condition being the cause of the death and the person being the cause of their own death. And fair enough, there is a thin line, but it can be illustrated with this following example. Suppose you're walking through the woods and you come upon a pond and you see a kid drowning in the pond and you do nothing and the kid just drowns. All right, that's pretty bad because you didn't help them, and maybe you could. But suppose you're walking through that same forest, you see a kid playing in a pond, you walk over, push his head in the water and drown him. Well, that's clearly wrong. And the difference between the two here, and why the second case where you push the kid's head under the water is definitely wrong and way worse, is because you are actually the cause. You're the direct agent of their death. Whereas in the first one, you're not the agent of their death. You just didn't do anything to interfere. So you're not technically the cause. And that difference makes a tremendous moral difference between removing of life support and assisting in suicide. Now finally we come to one final type of medical decision that people are sometimes confronted with towards the end of their life, and this is what is known as euthanasia. And euthanasia is a lot of times confused with physician-assisted suicide or assisted suicide, but they're very, very different. And the difference between the two is, in assisted suicide, what you're doing is you're helping a person kill themselves. So the person who dies actually kills themselves, and you're just assisting. Whereas in euthanasia, what you're doing is you're the one who's killing the person, and you're doing it. What's specific about euthanasia and how it's different from, or allegedly different from murder, is that in murder you're killing someone without any kind of justification. You're doing it because it serves your interest in some way or another. But in euthanasia, you're killing the person in order to put them out of their misery. We a lot of times euthanize pets, like euthanize a dog because the dog is old, the dog has a tumor, the dog has a broken, or a horse, for instance. A horse breaks their leg. You can't just put a horse leg in a cast. You can't do that. Their legs are just not strong enough. So we'll euthanize the horse. We'll kill it to put it out of its misery. And that's what euthanasia is here as well. It's in the type of killing where you're killing another person to put them out of their misery. And this one is much more morally complicated than even physician-assisted suicide, because or just assisted suicide generally, because assisted suicide, that person is actually killing themselves. You're just assisting them. You're helping them. But in euthanasia, you're the one who is killing them. And so the difference here can be represented by thinking like this. Assisted suicide, I hand a person a gun, and they put it to their own head and kill themselves. With euthanasia, I'm the one that puts the gun to their head, and I pull the trigger, and I kill them. And so that would be the difference here. And euthanasia is not legal in any state right now. Euthanasia is something that if you do it, you will not pass go, you will not collect $200. They will carry you to jail if you euthanize someone. Physician-assisted suicide, however, like I said, this is one, the second one I have listed up here, is a bit murkier within the law. It's a bit murkier within philosophy and morality, because people are sympathetic to it. You're not killing someone else, you're just helping someone kill themselves. And so that's something that is a little less clear what should be legal and what is also moral in that case. We're not going to, in our class, talk too much about, though there are some ethical questions that can come up here with passive euthanasia. We're not going to, I'm sorry, with removing life support. We're not going to talk too much about that. And we're also not going to talk too much about euthanasia, although there are interesting questions for both euthanasia and removing life support. We're going to focus on physician-assisted suicide primarily, because this is the one that, at least in public discourse right now, is the one that receives the most amount of consideration and discussion. It's the one that people who are defending defending any kind of right to die. They focus on assisted suicide. Very few people want to defend euthanasia at this point publicly, though there are some on the fringe. And very few people want to argue against removing life support. All the controversy in the public and political sphere right now in America really centers on the second one here. And so that's what we're going to focus on for the purposes of our discussion. Now, I'd asked you guys to read an article by this man right here, Timothy Quill. And the reason I did is because Timothy Quill was a doctor who specialized in palliative care. I think he still may be practicing, though I'm not entirely sure. But he came to national attention in the early 90s when he published an account of how he helped a patient of his who was suffering from terminal cancer commit suicide. And now, I should have mentioned this, but a doctor who specializes in palliative care is someone who basically helps people with pain management. We have doctors who specialize in all kinds of different things, and as it turns out, helping people manage their pain is not just so simple as just saying, oh, here, take some Percocet and you'll be fine. You have to be very, very careful with how these drugs are administered. And as people develop, progress with their diseases, especially cancer, it can become extremely painful, and you have to be very, very careful that you don't prescribe too much of something, or that you're prescribing enough so that their pain will be effectively managed. Now, what was really interesting about this is that Timothy Quill, as I was saying, he wrote up an account of how he had prescribed a lethal dose of barbiturates to a patient, and he had worked with her for a fair number of years. He knew her very well, and he published this in the New England Journal of Medicine. And the reason this was so fascinating is because physician-assisted suicide was and is still illegal in the state of New York. And yet he published this, knowing that he could go to jail as a result of this. I mean, basically he's confessing, hey, I broke the law here. And he published this. But as it turns out, the grand jury failed to indict Timothy Quill as a result of this. And the reason I mention this is because, as I was saying a moment ago, uh, you know, even though this is against the law for doctors to help patients kill themselves, even though it's technically against the law, it's a very, very hard thing to prosecute. And a lot of the reasons it's hard to prosecute is because the truth is that the laws are very murky when it comes to this type of thing. Sometimes they don't exactly spell out in the law exactly what it is to assist in a suicide. But then also jury members are just, to be quite honest, sympathetic. I think a lot of people have had family members who have suffered from diseases, and they understand the idea of wanting to help someone end their life. When life has just become a burden and too unbearable to them. The reason Timothy Quill did this is, obviously he didn't know what his legal fate was going to be ahead of time, but the reason he published his account is because he wanted to draw attention to the topic of physician-assisted suicide. And he was and still is a huge champion for the right to die, for a patient's ability to end their life when they see fit, if life has become a burden to them. The thing about Timothy Quill, though, is he wants certain protocols to be in place. And I think he is the voice of what you might call the reasonable voice of this movement, or the moderate voice of this right to die movement. He thinks that physician-assisted suicide should only be for those who are terminally ill, that is, people with 6 months or fewer to live, and people who are in unremitting pain. If you are not in pain, if you're just not in agonizing pain, if you're not suffering from any kind of loss of dignity or loss of rationality or anything like that, Timothy Quill doesn't think you should be allowed to die. And furthermore, he thinks that this decision for someone to end their own lives and to gain assistance from a doctor is one that should be taken with the utmost caution and utmost seriousness. And really and truly, it should be a doctor working in concert with a patient that he or she knows very well. Doctors shouldn't just take this responsibility to assist patients in this way as something cavalierly or lightly. They should know the patient. They should know whether or not reasonable alternatives have been exhausted before they go to this step of helping the patient end their own lives. And Timothy Quill published this, excuse me, not just to draw attention to this issue, which he considers an important civil rights issue, but because at the time, prior to Quill, there was another figure who was creating a lot of buzz and drawing a lot of attention, and Timothy Quill objected to this figure. This other person was also a champion for the right to die movement, and Timothy Quill thought that the way this other person was approaching the matter was completely counterproductive for the movement that the right to die movement that Timothy Quill was also a part of. And this other person you may have heard of, he's a much more well-known individual, is a person by the name of Jack Kevorkian. And for some of you who are unfamiliar with Jack Kevorkian, he was a Michigan doctor who assisted with a lot of people over the years. Jack Kevorkian actually assisted, as you can see up here, about 130 deaths between 1990 and 98. And I have some. He had assisted with one of the first cases involved a person by the name of Janet Atkins. She was 54 years old, suffering from Alzheimer's, and he assisted her death. And it turns out that again, he was brought up on charges of murder for breaking the law in Michigan, but those charges were dismissed. His medical license was revoked in that state, but he wasn't sent to jail. And afterwards, like I say up here, he assisted in over 130 deaths. And in each case, even though he violated the state's laws, I mean, he traveled to different states. Even though he violated the laws, there were zero prosecutions that actually stuck. The charges never stuck. And as I was saying a moment ago, what Timothy Quill objected to was the cold, sterile way that Jack Kevorkian approached this. Jack Kevorkian, in a lot of cases, did not know his patients at all. In many cases, he had only known the patient that he helped to assisted in their own death for less than 24 hours. And it was almost like he had this kind of, I don't know, food truck death that he would kind of say that. I'm trying to think of, it's like, you know how the ice cream truck comes around, rings its bell, and you can go out and get your ice cream? Jack Kevorkian was almost this way with assisting people in their own death. He would come to your house with what was known as his death machine, set it up, and then you could kill yourself. And here actually is what was casually called the death machine. You can see it right here in the image. It was just this sterile metallic rack that these chemicals would hang on right here. You'd stick a syringe. These chemicals, they'd filtered through these tubes right here, and then you could stick a syringe into your arm, and then you'd hit a button, and then you'd be dead. And Kevorkian, not only was it this kind of cold, sterile nature of approaching death, but he was just a very provocative, controversial figure. And Quill was what he was trying to do when he published his account was show, you might say, the more positive side of this right to die movement. He thought Kevorkian represented the worst face of it, and Quill was trying to represent its best face. Now, some of you probably know the story of Jack Kevorkian and know that he ended up going to jail eventually, but that was not for assisted suicide. What happened is that Kevorkian actually euthanized a man, Thomas Youk, back in '98. Kevorkian, in this case, what was different about this case is that Thomas Youk did not kill himself. Kevorkian hooked the machine up, hit the button, and so directly injected Youk with the lethal dose of medication, and then Youk died. And this crossed a major threshold. And the threshold it crossed was that Kevorkian was now the one who was the cause of the person's death. He wasn't there just assisting, he was actually causing their death. And as a result of this, and I failed to mention the most important part, I guess, is that Kevorkian videotaped the event and allowed it to air on CBS. So this was really brash on his part. I guess he had just figured that he had got away with it for so long that he had and pushed every boundary line that he would continue to get away with it. But as it turns out, he didn't. And he was charged with second-degree murder, and he was sentenced to serve 10 to 25 years. He ended up not serving the full amount of time. He only served about 8 or 9 years of that sentence. But he, as a condition of his parole, he had to never again assist anyone or certainly not euthanize anyone. But he remained an advocate of both euthanasia and physician-assisted suicide until the day he died. Now, something too I failed to mention here, and this is really what I think was the catalyst that spurred Timothy Quill to come out against Jack Kevorkian, is that the person that Jack Kevorkian had initially assisted in dying, and sorry, let me just back up a screen here. The person he had initially assisted in dying was Janet Atkins, and she wasn't terminal. She had Alzheimer's disease, but she wasn't actually terminal. And I think this is really what pushed Timothy Quill to the breaking point where he said, look, I want to come out and represent this right to die movement, and I want to represent it the way it should be represented, not the way this guy Jack Kevorkian is doing it. He is what Kevorkian was trying to say was that anybody for any reason whatsoever should be allowed to die or euthanized. And Timothy Quill wanted to say, no, there has to be a hard and fast line. Only those who are terminally ill, only those who are in a lot of pain. So here we have represented two sides of this right to die movement. And for whatever it's worth, I just show you some statistical information. This is a Gallup poll that goes back, it's a couple of years old, but not too old. And it shows public support for this. And this is actually really interesting because, as you notice here, public support for euthanasia tends to be, I'm sorry, not for euthanasia, but public support for physician-assisted suicide is there. I mean, the majority of Americans think that if a person is living in severe pain, then by law, doctors should be allowed, if a person is living in severe pain and their condition, they have an incurable condition, that doctors should be allowed to assist that person in death. That number has come down here, but it's remained fairly constant. And you can see from 97 until 2013 that the majority of Americans think that, yes, a person should be allowed to end their own life. And like I said earlier, I bet a lot of us have known someone who has been in one of these conditions where they're just suffering away for years and years and years. And there comes a point where for a lot of people they just say, I don't want to live anymore. Life is too burdensome and I would just rather die than have to live another day like this. And there is public support there, and that's interesting because even though the majority of Americans have supported this for a long time, it still remains illegal in most states. Here you can see just a little bit more background information about it, where physician-assisted suicide is currently legal in Oregon, Washington State, Montana, Vermont, New Mexico, and California recently legalized it. But as I said, even though it is legal in these states, there is what you might say increasing decriminalization, and what that means is not really treated like a crime. It's a really weird thing. It's kind of it's almost like, you know how people will put bottle like 40s or alcoholic beverages in a brown bag and then they can walk in public and drink it. And it's like, all right, we know you're doing it, but it's kind of out of sight, out of mind, so to speak, so we're not going to prosecute it. I think a lot of people know that this goes on. They just kind of turn an eye to it, or when they find out about it, they know it's really hard to get a prosecution, so they don't really pursue it at all. I mean, in order to get a prosecution for this, something really has to be out of the ordinary. It really has to be an egregious case. It's just because the sensibilities of most Americans are such that they support physician-assisted suicide, that they're sympathetic with it. It's not something that gets routinely prosecuted. For whatever it's worth, and maybe it's worth very little, it also is the case that medical opinions are somewhat split on this. That it's a very conflicted issue. In what is the American Medical Association, which is the largest medical association in the country, there is just outright opposition to it. However, in the student version of the American Medical Association, there's actually support for physician-assisted suicide. And in another very large medical association, the American College of Physicians, there's ambivalence. Like if you read their statement on it, it's like sometimes you're like, wait, are they for it or are they against it? It's not really clear where they come down. They're torn. And I think what the kind of differences of opinions we see represented among doctors is really representative of just the difference of opinions of Americans themselves. Like I said, people are sympathetic, but there's also there are laws that are against it as it stands. So it's a very conflicted issue. Now, when it comes to the issue of physician-assisted suicide, just as with abortion, there are two different areas where we can raise really interesting and important questions. And on the one hand, we can ask about the morality of physician-assisted suicide, which we are going to talk about. We can also talk about, apart from that, the legality of physician-assisted suicide. And here we're going to talk about this also. We're going to address both of them because just as with abortion, where we were discussing that and we said, well, look, you might be morally against it, but legally you think it should be allowed. Same thing you could say here for physician-assisted suicide. And what I imagine is that there are a number of you who will probably feel like that you morally oppose it, but you think it should be legal for various reasons. So what we're going to do is we're going to begin by talking a little bit about the morality of physician-assisted suicide in the next video lecture, and then the one after that we'll transition and talk some about the legality of physician-assisted suicide.